warm welcome to Dr. McCart. Thank you for joining us this evening.
Thank you so much, Mary. I really appreciate your help and the very, very kind introduction. Thank you to you, thank you to George, and to the Montvale Library for hosting us this evening. It is my pleasure and my honor to meet with you all tonight and discuss the benefits of chiropractic care, specifically through Valley. So, some of you may have some experience with chiropractic care. Some of you may be completely new to it and just have some questions. What's the safety? What can you help with? What do you do and how do you do it? So we're here to address all of that tonight. And I thank you so much for taking the time out of your busy days to do so. So let's get to it. Oh, so who is a chiropractor and what do they do? Chiropractors are licensed neuromusculoskeletal healthcare professionals. So what does that mean? Neuro is nerve, musculo, muscle, skeletal, bone, joint healthcare providers. We really focus on those aspects of the body, but our profession has a very wide array of things. So, chiropractor, the term chiro comes from the term chirality, which means handedness. So, what do? We use our hands. We use hands-on techniques, whether that be spinal manipulation or mobilization. That's our bread and butter. We also have non-hands-on therapies that we offer for people that's, let's say, have disc herniations or spinal canal stenosis or osteoporosis, things like that. And we also prescribe stretches, exercises, nutrition. We check your ergonomics. We also, most importantly, collaborate with other healthcare providers. We are part of a team here at Valley. We work in the integrative medicine department with wonderful acupuncturist, massage therapist, my wonderful director, Dr. Lori Nuzzi. And then, of course, we work alongside the other healthcare practices. So on a daily basis, we are referring to endocrinology, we're referring and co-managing with oncology, primary care. We're working with the physical therapist. We do our part in our lane to help the patient have overall health and wellness. The beautiful thing about what we do, though, in our little part of the world is, as Dr. Nuzzi says, a lot of people work in the black and the white, and here we work in the different shades of gray. And we do that through drug-free, surgical-free, non-invasive, evidence-based, whole patient-centered care. Now, a little bit about spinal health and the science behind it. Let's start with something called the central nervous system. So the central nervous system is essentially the brain and the spinal cord. Anything to happen in our bodies, whether it be our heart beating, us moving a finger or a toe, starts in the brain, goes down the spinal cord, which is housed by our spine, right? And then out to the spinal nerves. That's the peripheral nervous system, anything outside of the brain and the spinal cord. So I like to consider the spinal cord as Route 80 and all the spinal nerves that exit out each side, and they do so on either side of all of our 24 bones in our vertebrae and our spine. And I consider those the exits off the highway, east and west, right? We here are in the New York metropolitan area, especially a North Jersey girl myself. We don't like traffic, and we tend to get irritated when we're stuck in it. It takes us longer to get from point A to point B. We're irritable, and we just don't function as well as we would if we just had a nice, free, clear drive, right? So the same thing with our body. Our brain wants the message to get from point A to point B at lightning speed, even faster. And when we have, let's say, traffic on the highway or the exits, whether that be on the spinal cord or at the spinal nerve level or further out, right, into the muscles and the joints, it reduces productivity, it increases pain, irritability to that area, and overall just lack of proper function. So, which leads me to the next part, nerve function. Proper spinal alignment allows for us to have that message to get from point A to point B. We as humans have this really beautiful S-curve shape in our spine, which you see in the third image here. And that is meant to have that springiness the way you would have, let's say, in a skyscraper or let's say the Golden Gate Bridge. Now, why do we have that springiness? Well, it's meant to help us handle stressors from different aspects. But far too often, especially in such a tech world that we live in, we are hunched forward. So we take that S curve and we turn it into a C curve, and you can see it like this, right? And so most people are sitting at their computers at home or on their cell phone, they're looking down like this. And so what they're doing is basically applying forward pressure and putting all this extra strain on the spine, the nerves, the discs, the muscles, and overworking some things and underworking others. And when they're doing that, we are reducing our overall function, our mobility. We increase pain that way, muscle imbalance. It's basically like having a house with uneven foundation. When someone's looking to buy a home, right, the last thing they want is a crack in the foundation. And so our job is to find any cracks you might have, for lack of a better term, no pun intended. And we want to level out the foundation so that you can go ahead and build on that. So when you're sitting at work or when you're exercising, when you're going for a run, you're able to do so with less discomfort. Evidence-based results, right? So like I mentioned, here at Valley, we are all about the evidence, patient-centered, holistic care. And what does that mean? We make sure that the care that we provide is at the highest level. So how do we get to that? Well, we look to the science. There are hundreds and hundreds of randomized controlled trials that support the effectiveness of chiropractic care for musculoskeletal conditions: neck pain, headaches, low back pain, overall stiffness, shoulders, hips, knees, ankles, wrists, even fingers, guys. Kind of crazy. We do it all. And the wonderful thing about what we offer is that patients do so well that they have extremely high satisfaction rates, and not just in themselves, but high referral rates. Recent studies show that referral rates for patients of chiropractic to refer a friend or family go as high as 82 to 84%. So I think with numbers like that, you'd say to yourself, wow, how do we have, how do they get there? What do they do? Well, we work on, like I said, posture. We work on various things, but this aspect of it is how we like to start. So, like I had mentioned earlier, we get a lot of forward head posture from screen time, forward rounded shoulders from working at our desk or even driving, right? Truck drivers are sitting for prolonged periods of time. Their shoulders are rounded forward, they're compressing their low back. The science says that sitting is the new smoking. So 8 hours of sitting per day is the equivalent of damage to the body as smoking a pack of cigarettes in a day. So that's pretty hefty, right? So how do we combat that? How do we fight the muscle imbalance and the chronic tension, the neck pain, the headaches, all of that? Well, we work to restore proper alignment in the spine, in the joints, all throughout the body, and not just the spine, right? It's musculoskeletal, right? So we work on the muscle as well. If we just work on the joints and we don't work on the muscle, it's kind of like a one-handed handshake. Nobody really, it's not a thing, right? So we want to infer and we want to confirm that the patients are getting corrective exercises, strengthening, ergonomics. We'll sit and say to a patient, let's say, for example, I have current pregnant patients, and one of the biggest problems they have is getting up in the morning, getting out of bed. I also have that from my older patients who have low back pain. So what we do is say, show me how you do it. And then we go into how can we correct that to empower you to have a strong foundation in yourself to know how to correct something. And these little changes have exponential improvement. They go from experiencing really sharp pain, let's say in the hip or in the neck and shoulder, all the way down to having very little pain when they do those movements and getting that aspect of their life back. And of course, we work on long-term postural rehabilitation programs. My goal is to not have you come in and see me forever. My goal is to have you be independent from what I do as opposed to dependent on. And we do that through long-term postural rehabilitation treatments. We discuss, you having specific water and electrolytes to avoid sore muscles, proper bending, lifting, and twisting skills. Pain relief. The spinal manipulation or the adjustment not only increases mobility, it reduces pain, it helps to stop the pain cascade on a chemical level in the body and just helps with promoting overall wellness. But how do we get there? We start with a very comprehensive evaluation. Prior to any patient coming to us, we'll go through your chart and we will see your previous visits with other healthcare providers. We'll see your health history, learn about your family history, your surgical history. Then we confirm that with you on your evaluation, and then we listen to you. What are you telling us as the patient? What are your concerns? What are you finding that's hard? What are you experiencing throughout your day? Is your pain worse in the morning when you first get up? Is it worse in the evening? Is your goal? I've had some recently actually. I had a patient say, Doc, I want to be able to walk my daughter down the aisle. That's a goal. Let's make sure that we can get you to your best self so that you can do so. Or, Doc, I want to be able to pitch a ball to my kids. That's a goal. Okay. I have people who say, I want to get back to Pilates, or I want to be able to walk again. I can't walk more than a quarter of a mile without back pain. Well, those things are all part of our assessment. We look at the physical, the emotional, and the mental toll of what it is that you're experiencing and how we can help, right? And we do that history, then we perform a comprehensive physical exam, neurological exam, and orthopedic exam. We make sure we are ruling out any red flags, anything for referrals, and we also, of course, will go through with co-management. This is a team effort here. We know that we are really good at what we do, and there's other disciplines that are really good at what they do. And so we make sure we are giving you the best version of ourselves to get you to be the best version of yourself. After we've done that evaluation, we've discussed your care plan, you've told us that you're on board with what we're doing, then we'll discuss treatment options. We will start with care that day if we're able to, or if we need to hold off, we will. When we get to that opportunity to start treatment, we use targeted spinal manipulation and soft tissue therapy techniques to address the root problems. Let's say there's a patient who has a certain condition where, they're pregnant, it's hard for them to go on their side. That's fine. We'll treat you seated. Or if you have an acute condition, something that's less than 3 months old, we're going to cater to that care plan based off of that finding. Or if it's a chronic condition. And the beautiful thing is, guys, there are so many studies to show that we can help in both acute and chronic conditions. So we're very fortunate in that sense that we have the opportunity to help you in all aspects of life. Like I said, those different shades of gray. How do we get there? Well, we discuss the natural healing process and try to help your body to get there. When you're sitting there working and all of a sudden you get a paper cut, you don't instantly run to the ER to start getting sewed up for that little paper cut because it's not something that you need outside external forces to fix. The body wants to fix it itself. And that's our job, is to help it get rid of any sort of traffic on the highway, the exits, like I said, whether that be from herniations or spinal canal stenosis, any muscular or fascial adhesions, anything that would be compressing those things and hindering the ability for the message to get from point A to point B. And finally, prevention. Their best rehab is prehab. We want to get you to the point where you are in a state of wellness and you are empowered and able to take care of yourself, right? The saying, I believe, is an ounce of prevention is worth a pound of repair, right? We want to ensure that we're giving you that opportunity to promote long-term spinal health. We want to provide those modifications to give you the strength, to give you the ability to function on a daily basis without needing us here. Enhanced mobility. Like I had mentioned, the adjustments restore proper joint mechanics to hypo meaning less mobile joints. And then we want to strengthen the hyper, too much movement joints. We want to stretch here, strengthen here, and focus on improving overall mobility and wellness. This will allow you to be able to look over your shoulder to change lanes without pain and discomfort or having to turn your whole body, right? All of those things matter on a daily basis. the muscular balance that you might have, some tension with certain movements. You feel like, oh, I can't get my arm all the way up over my head. Well, why is that? Let's look at the form and correct that so that we can correct the function from there. Flexibility, overall body flexibility, coordination, allowing the body to function at a higher level so that you can just go about your day doing things the way you want to, the way that you're intended, the way your body is intended to do them. Some research highlight. The JAMA study that we're talking about, JAMA is short for Journal of American Medical Association. So this is an American Medical Association. This is not a chiropractic association journal. These are peer-reviewed journals. These are very large and widely recognized journals. So the study was a large comparative study comparing the effectiveness of medical treatment for patients' pain and discomfort along with medical care and chiropractic together. And the study showed significant pain relief, improved disability scores, and higher patient satisfaction with combined chiropractic and medical care as opposed to medical care alone. So, what does that mean? That means when patients were coming in to do this study, they not only said, this is what hurts, then they filled out forms that said, how does it affect your sleep? How does it affect your daily life? How does it affect your ability to interact with your friends, family, loved ones, and coworkers? How does it affect your ability to dress yourself in the morning? Grab your laundry basket, run after your kids. All of these things matter. And the treatment of chiropractic with medical care together, combined, working together integratively, is what really took it home for these people. They had improvement, significant improvement in all of those things because of that. And that, I think, speaks volumes. Now, when we feel better, we also will function better, right? So our body has our sympathetic and our parasympathetic nervous system as well. Our sympathetic is our fight or flight. Our parasympathetic is our rest and digest. And they work in seesaw of one another. They are inverse to one another. So what does that mean? When our fight or flight is really high, our rest and digest is very low. And being that, like I said, we are in the Northeast, specifically the New York metropolitan area, we tend to be in a heightened state of fight or flight. We're stuck in traffic, we're working, we have deadlines for our jobs, running after our kids from one sport to the next and make sure we have dinner ready in time and all that fun stuff, right? And all of that will shut down our rest and digest, our ability to function and relax and go to sleep at the end of the night and have restful, meaningful sleep. When you get adjusted, it actually raises your parasympathetics and shuts down your sympathetics. So the parasympathetic goes up, your rest and digest goes up, your sympathetic, your fight or flight goes down. And you end up having better sleep, which means more energy the next day because you are not overworked and underpaid and feeling like you have to steal from Paul to pay back Peter, right? And being that as it may, it also adds to your immune support. Like I had mentioned, if you got the cut, your body would want to heal it on its own. And we offer the ability to have a natural immune response that way. And I also tell patients when you get treated, it becomes this really amazing thing where your proprioception, so your body's awareness of itself in space, improves. So it's kind of like having a more sensitive smoke alarm in your house. So instead of the smoke alarm going off when there's a full-blown fire and half the house is gone, you'll notice when there's a spark. And that's a good thing because pain is something telling you that something is wrong. And we want to find where that is and how to fix it before it becomes a real issue. So that's a really beautiful thing that we get to offer as well. And stress reduction, like I said, our parasympathetics are increased. So our rest and digest, our feeling of comfort. One of the greatest compliments that we receive, aside from patients referring other patients, is that patients end up falling asleep on our tables, or they say, Doc, this is the only time that I have for me in my whole week. They'll come in, they'll get treated, they have a feeling of overall wellness, reduced stress level, better mental and emotional well being. We care about you, not just your symptoms. So we'll ask you, how's your family doing? How's work going? Are you finding that you're able to go about your day better? And how can we further help you to improve in those aspects? So again, why choose what we do? Why seek chiropractic care? Well, it's drug-free pain management. There's, you're not getting all those side effects, the drowsiness. You're not having to go under the knife. Patients will come to us and say, my surgeon actually told me I'm not a candidate for surgery for my neck pain or my back pain, and I really didn't know where to turn. And so they told me to try the chiropractor. Yes, absolutely right. We work with neurosurgeons, orthopedic surgeons, pain management, physical medicine and rehab. We work with all of these departments because they all have their place. And they say, hey, you're not a candidate for this, go there. Or we can help you in this aspect, but massage can help you in that aspect. We offer really effective treatment, really effective care for very minimal side effects, and we complement the other healthcare departments. We really love that part. So, safety, right? This is a question that we get pretty often is how safe is what you do? Well, systematic reviews confirm the safety profile of spinal manipulation. They show extremely low rates of serious complications, and most side effects are truly, quite literally, soreness or stiffness if a patient tenses up when they're getting treated, let's say. There's large scale studies that show the low risk nature of our care and how widely received and well received it is to the body and overall. And professional guidelines emphasize proper patient screening and techniques. The wonderful thing about what we do here in our part of the world is we are really focused on offering a really great initial evaluation. We're doing all of those screenings ahead of time. We are ensuring that, hey, we are doing our due diligence to make sure we are doing no harm. We are offering the best patient care possible. And we're going to do that how? By doing that really great comprehensive evaluation that I had mentioned earlier. And we continue to ask you how you're doing every visit. If something changes, we're making sure to hit pause and let's discuss. Of course, risk of traumatic injury is significantly lower than common medical procedures, as well as compared to long-term medication use, and definitely significantly lower than surgical intervention, with minimal contraindications when it's properly assessed. So what does that mean? If we do our job correctly, you're getting the best care possible. And we are very proud to say that we do that here at Valley. So some top questions that I get about chiropractic care. Are chiropractic adjustments safe? When performed by licensed healthcare professionals, licensed chiropractors who have gone through all of their education, gone through their board exams, have really great track records, yes, it's extremely safe. Now, I have a question for you guys. I ask this a lot because a lot of people know that you either have, let's say, regular health insurance or you have auto insurance. You may even have malpractice insurance, right? The average malpractice for medical doctors, depending on discipline, ranges anywhere from $50,000 to $200,000 per year. Now, I'm going to open it up to you guys to put in the chat a number that you think that chiropractors have to pay out for our yearly malpractice. And I'll give you guys a minute to kind of go ahead and do that. Okay, we have 10K. Anybody else want to venture a guess? Give me another couple seconds. 150K, okay. Someone wrote $159,000. Very precise. I like it. Well, as they say in The Price is Right, the actual retail value is $2,500. That's a, we got more answers. Okay. Yes, $2,500. So if you think of how much you pay for auto insurance for, let's say, your young teenage son for the year, we pay about that or maybe even a little bit less, um, which is very exciting. I think that speaks volumes as to how safe and effective what we do is. You guys know insurance companies are very big on risk. They always want to make sure that they're hedging their bets and they're having you pay up for the safety level that they think what you do offers, right? $2,500. That's what we pay yearly for our malpractice insurance. I think it's a fantastic thing. Next, do I have to keep coming forever? No, absolutely not. The same way you start out with, let's say, an exercise regimen or working in physical therapy, rehabbing, right? Your frequency is going to be higher in the beginning. And then as you stick to the care plan and improve, we graduate you to a lower frequency. You're going to continue to improve and then hopefully get you on a maintenance plan. What does a maintenance plan look like? Let's say maybe once a month, once every couple months, a couple times a year, depending on how your health history is, your response to care, and what your health and wellness goals are. It's kind of like going for an oil change for your car, right? You're not going to run the car into the ground and never get an oil change. It's the same situation. If you decide that you want to run and function better, come in for a couple times in a year. But there is no requirement in this aspect. There is no set number. I'm not going to tell you to come 3 times a week for the rest of your life. That's not how we do things here at Valley. Are chiropractors real doctors? Yes. Yes, we are real doctors. Our education in the first year of our program actually looks very similar to what medical doctors do. We get a full year of gross anatomy, which is going over and working on cadavers on the body. We get neuroanatomy. We dissect brains and nerves and all the funky, gross stuff. We do histology. We go through the whole gambit. Where we really split off is our second year of education. And that's more because we focus more on the body and they focus more on illnesses and surgeries and medications, which is what they are absolutely amazing at. And we are grateful that they do that. Our education is 7 to 8 years of university education combined with national board exams. You have to pass your national boards in order to be a licensed chiropractor. In the state of New Jersey, we have four parts with an optional fifth. And Dr. Nazi and myself are certified in all 5. We've passed all 5 of those, of course. Can chiropractic help with more than back pain? Absolutely. We help with a wide variety of neuromusculoskeletal conditions. So neck pain, headaches. I have people who play the piano for a living and their wrists and hands and fingers get really tired and achy. We treat that. Some knees, ankles. We check how your gait pattern is, how you walk, and how we can help correct that because that creates different structural and functional issues as you go further up the body. So we do treat a wide variety of conditions. And how do we do that? Again, with a really comprehensive initial evaluation, we go through your current health history, your surgical history, your lifestyle issues, conditions that are contributing, and we cater and curate a plan specifically for you based off of those things and your health goals. And then again, we work on empowering you to have ongoing wellness, any sort of maintenance care for you, whether that be training you on stretches and exercises for you to do at home on a daily basis to help improve, using an exercise ball to open up that mid back and low back, laying yourself over the top of that. Whatever the case may be, We are here to help you. We are very excited to do so. And we are very passionate about what we do. And I would like to take this time to thank you all for listening in tonight. I'm very grateful to you, and I'm thankful for your attendance and your questions. And I look forward to answering some now. So if you have any, please don't hesitate to go ahead and put those in.
We do have a question here. The first one is, can you handle scoliosis?
Absolutely. We treat patients with scoliosis. I think I had 2 scoliosis patients today. We work on trying to improve the muscular and the skeletal imbalance with that. We may incorporate you co-managing with other healthcare disciplines based off of what your condition is, how severe, what your goals are, and what your daily life is like. And we work with you on there. Thank you for your question. Absolutely. We do help patients with scoliosis.
Awesome. And another person is asking, do you need a referral from your doctor?
So the beautiful thing is the answer is no. We are primary healthcare providers, save very, very few minuscule healthcare plans that would ask for that. Most are not. We are primary healthcare providers. You can come to us without a referral.
Does Medicare cover this service?
Great question. So Medicare absolutely covers chiropractic manipulation. They cover manipulation of the spine, and we go through and curate a care plan for you based off of that and your healthcare needs. We go through everything ahead of time so you know what's covered and what isn't if something is not.
Perfect. And then someone else answers, does health care or health insurance cover this?
Yes, great question. Absolutely. Health insurance does cover chiropractic treatments. It is widely accepted, highly approved. If Medicare covers it, all the other health insurances know that they too must follow suit. So great question. Thank you.
Thank you. We also have another here. Can you treat people with osteoporosis?
Amazing question. Absolutely, we can treat people with osteoporosis. Our osteoporotic patients receive a little bit different care. So instead of us using our hands to do the treatment, we might use something called an activator, or we might use a technique called flexion distraction. We might use kinesiotaping. There are so many different techniques that we can use to treat the patient based off of what their condition is. And we treat osteoporotic patients all the time. We have people I think my oldest patient was 94 years old. Obviously, they had osteoporosis. We make sure that we are catering to them and their needs. Thank you.
And another question is here is the physician assistant that I saw at Valley recommended you to me for lower back pain. I've always been afraid of the manipulation, but they can't do anything else for me, so I think I need to try this.
Well, first of all, I'm very sorry that you're experiencing the low back pain, and I appreciate you taking the steps to listen in tonight to get to know more information. A really great question that I did not put in here, I do apologize, is people may have a concern about the sound, right? The adjustment itself, the crack, if you will, for lack of a better term. So the sound that you hear when you get a spinal manipulation is not bones cracking, thankfully. That would not be a very good healthcare profession. It should definitely not be recognized, that's for sure. The sound is what we call a liquid to gas exchange. It's the same way when you open a soda can and you hear fizzing, that's that liquid to gas exchange. But because it's happening inside of our body, inside of what we call a joint capsule, right? So it's a covered space under many layers of muscle, tissue, bone, nerve, and skin. That's what makes it the pop sound or the crack sound. It is not bones cracking. It's extremely safe. And if somebody is concerned about that, we have other tools and techniques like the activator, like flexion distraction, like taping different techniques that we can do to help out. We are more than happy to do that. We're happy to curate our plan just for you with your conditions and your concerns, and we look forward to doing so.
Thank you. And I have one last question, it seems here. What lifestyle tips do chiropractors recommend to maintain spinal health between appointments?
What can you repeat the question for me? I'm sorry.
Sh- Sure. What lifestyle tips do
Okay.
chiropractors recommend to maintain spinal health during between appointments?
Between appointments. Wonderful. So, um, as Mary had mentioned earlier, I am very big on posture. I have a protocol that I recommend to my patients called uh, Posture Medic. It is a posture brace that you become independent from rather than dependent on. And what that offers is it's not just a regular brace like you see all the other ones on the markets. And I don't want to, poo-poo the other ones by name, but this is the only one in all my 2 decades of experience in the chiropractic profession that I have seen that truly makes a difference. And why is that important? Because we discuss the stretch and exercise program that that offers to help, like I said, take the overworked muscles in the front and relieve them and give them just their job, and take the underworked muscles in the back and put them back to work to really create that proper posture. We'll also discuss things like chin tucks, doing wall angels, improving shoulders, right? Rolling them down and back. But these would all be specific to the patient's current posture, to their conditions, and to their health. So always make sure you're going for an evaluation first, getting that information, and then we go from there.